Good morning, good day, good afternoon, good evening to whoever you are all over the world and in diaspora and here in Africa. We are discussing Africa on behalf of Africans to raise awareness. My name is Clevenard, and today I'm having the honorable. I'm so excited because I feel like honored to be having this honorable Commissioner Samuel Ali. How are you, sir?
Good morning, good afternoon, good morning, good evening, wherever you may be. Nice to be with you, Clevenard, on this show.
Good to have you. Good to have you, sir. We are going to be talking health. I hope people are there are ready to hear what's happening in Edo State. So just tell us more about yourself before we go anywhere. Can we hear about Commissioner Samuel Ali? Tell us more about yourself.
Okay. Um, Good morning again, and thank you for inviting me to this show. I'm going to start a little bit earlier than earlier scheduled for 11, but I think this will be like 10 minutes too. But no problem. My name is Samuel Ali. I'm a medical doctor, a graduate from the University of Jos here in Nigeria, with about 5 years of experience in medical practice, ranging from clinical to healthcare management, and all of that. So I started my career in medicine at the prestigious Dieko Hospital in Lagos, where I did my internship after my graduation 5 years ago. And then I went into practice with various hospitals in Lagos. Foremost among them was the Lagoon Hospital in Lagos. And then from Lagoon Hospital, I went into the health insurance business because it was new, and it was so exciting to know how we can actually finance health system, especially in low resource countries like ours. So I went into that Hygia Nigeria Limited, and from Hygia we went to Unique Health, where we did premium for them. So for the next 10 years, I was insurance helping to ensure that Nigerians were able to get access to healthcare by paying a premium ahead. It was novel. It was initially very challenging, but with time, people begin to embrace it and begin to see the benefit that put to health insurance. After that, I went into the hospital management itself, managing hospitals, multi-specialist hospitals. One of them was the Lily Hospital in Warri. Was with them, and then I went back to clinics to do my postgraduate in obstetrics and gynecology. And I just wanted to have a full knowledge of the whole spectrum of the healthcare. I started as a clinician at a young age, and then went to health insurance and hospital management. I wanted to feel how it is to work in clinics again. So that was very challenging too, during my residency at North. And then after that, I got this job as the Honorable Commissioner of Health. So I think I've been through all the health system. One of the doctors probably that have been through all of the health systems in Nigeria.
Oh, okay. But then what really prompted the idea of starting the health policy itself?
Which health policy?
The whole health policy that you've started. What prompted it? What really made you, as you spoke about the people in Nigeria, but then what actually made you, or maybe what was happening with the passion to start the whole health policy?
Okay, a lot of Nigerians, because one, our country is a country of low resource setting, and so a lot of people are poor, and can't really afford healthcare, standard healthcare. And again, we really didn't know, despite the fact that I was a doctor, really didn't know much about what standards should be in terms of, not in terms of infrastructure, equipment of hospital, and the practice itself. So that prompted me to venture into such and said, let's explore this, let's see what it should be. We didn't have the opportunity to actually see what the other side looks like. And so now that it's coming in, it's good to key in and see what it is like. And let's see how we'll be able to use that to strengthen the health system in Nigeria and also to help people to key in into proper health system and benefit from it instead of the self-help that is quite common among us.
Mm-hmm. Okay, then when was it conceptualized? The whole idea. When was the whole idea conceptualized?
This should be like maybe 15 years ago.
Oh, wow. This is quite a long time ago, but it's good to hear that there's someone like you who thought of the people, especially what's happening there in Nigeria. As you said, you saw that people are very poor and they can't access the resources for health, or they can't access to go to hospitals, and you thought of them. And it's a good thing, sir.
Yeah, okay, let me be a bit personal. My mom died from complication leading to childbirth, and I felt so hurt, and I felt let down by the healthcare system. And since then, I've always wanted to, what can we do to help women, to help everyone, not just women? And I do see a lot of people die from just poor healthcare system or the healthcare system in the country. So that has always made me to always wanted to be a doctor. Maybe when I was young, and I was like, I don't want to see somebody die just like that. And then seeing all the gaps, growing up, becoming a doctor, and seeing all the gaps, and that also was a driving motivation for me.
Oh, it's a great thing. Some people just start things because they want to be honored, but it's good now to hear that it's coming from somewhere, and you just observed and you thought, now, you know what, I saw with my mom, so it became a passion of yours. So it's a great thing, and that way I'm very sure that it will go well. But I wanna hear, if so far, how has it been? Because as you say that it was from 15 years ago, and you are saying it's from the passion of your mom, the fact that your mom got ill and you saw that, you know what, this is important, and especially for you to start being a doctor, to get in the field itself. How has it been so far?
Good. Very challenging initially, but I think we are getting a lot of things right in the health sector. Generally speaking, now a lot of people are keen into the health insurance system. A lot of Nigerians are beginning to have faith in our hospitals. In the past, there's so much medical tourism outside of the country, but now people can realize that you can also have same quality of care in some of our private hospitals here in Nigeria. So it's been great seeing the transformation in the health sector, and that I've been a pioneer, or I've been a contribution. I've also contributed in one way to getting it this far.
And then the challenges, advantages, disadvantages, if you have.
Didn't get you. I'm not getting the question.
Challenges, like the advantages and disadvantages so far, if you can mention them.
Okay, advantage and disadvantage. There's nothing that doesn't have its own downside of it. But I think gladly the advantages have been more.
Okay.
Well, I wouldn't call it disadvantage. I would just say, what are the other gaps that are left? We need to, financing has been a major issue, because healthcare is expensive. And with time, I think our government, we in government are beginning to, people in government are beginning to realize that healthcare is one of the key indices for development, and they are beginning to realize it. And two, they are also beginning to see how they can pull more funds into it, like what we do in Edo State. My governor is very keen on healthcare. Is one of his priority and focus area. So from time when I started working with him, he has always told me we need to change the healthcare dynamics in our state. We need to improve the numbers. We need to have more positive indices from health. So I would say the gaps include financing, awareness, that's knowledge, and then infrastructure. I think that's, then again, more recently, in the last 2 or 3 years, personnel. Personnel, because a lot of our doctors and nurses and others are now moving out of the country because of the poor economic situation generally. So it's making us not to have a lot of the personnel to man many of our hospitals, especially government-owned hospitals. So
Okay.
those are what I call challenges or gaps, not necessarily disadvantages.
I hear. Yes, it's actually just few things that you need to patch on. It's not really disadvantages. It's good to hear. It means it's doing well so far. I don't know, but then I'm just thinking from what I'm hearing from you that it's doing well. You are doing well.
The governor is doing very well in the health sector. I'm not saying it because I'm part of the government. I'm saying it because that is the reality on ground. That's the reality on ground. He has provide access in terms of the state health insurance, and he also make provisions for the vulnerable. Just this month, we enrolled pensioners into the scheme. They didn't have to pay; the government paid for them, so that the pensioners are old and most of them will have one chronic disease or the other, and the governor just said, "Look, let's take care of these old people, and I think this is the best I can do for them. I roll them into the scheme at the cost to the government." But we also have a fund set up for the vulnerable group in the society, and that we also go around the society to see the poor of the poor and see how we can roll them free into the scheme also. So he's providing access in terms of the insurance. We are also working on terms of the second aspect of the access, which is the care point itself, that the hospitals are the providers of health. Classically, there are three levels of providers of health. We have the primary health care, the secondary, and then the tertiary. We are doing so well in primary health care, making sure we renovate and equip some of them to standard, whether we want to call it international standard to standard. A few of them do have telemedicine capabilities, and we have doctors overseas that we engage, which we engage in carrying out these telemedicine in some of our primary health care centers. In terms of our tertiary, we have one standard Edo State specialist hospital, which is a modern facility equipped and able to provide multi-specialist care to many of the citizens with referral from our private healthcare centers. We are also building another multi-specialist hospital, the Stella Obasanjo Hospital, which also have a more a higher capability for care for everyone. That one should be commissioned later part of this year. We've gone far with the we are more than 50% in the construction and equipping of that hospital for now.
Okay.
So those are what we're doing in those states, making sure that we cover all the gaps in the system, to ensure that our citizens benefit maximally from what the government is able to do for them.
Okay, sir. Commissioner, I want to know again, with the whole movement, do you think that or maybe do you have any idea of stretching it to maybe other countries or even other provinces within Nigeria?
Yes, we do. Yes, we do. It's part of what people are coming from other places to learn what we are doing right, how we are doing it. And I think with time, people will be a yardstick for others to emulate.
Oh, okay, that's great. But then as you as a person personally now, do you have other people that you're mentoring, like in terms of this care, this whole thing of caring for people? Are you a mentor at some point? Maybe if I maybe personal?
Yeah, definitely I have. At my position, I can't do everything. So I have a team that I work with, and I try to show them how to how really to be a high performance, how to achieve your set goals and all of that. So just last month we had a retreat where um, our directors and all of that were also part of it. Yes, I do.
And then with
So
other organizations as well, do you
it's Singapore.
influence them in some way, like to tell them to do what you're doing, like just other organizations out there, maybe who are just about charity. Maybe you can also influence them to also do something like what you're doing.
Yes. Definitely, we do. We use the media to do that. We use a lot of our media platform to communicate to others what we're doing, and also we carry out advocacy. We also have regular courtesy visits and meetings with other stakeholders like the traditional rulers, communities, and all of that. We do from time to time.
But can you tell me about the direct recipient in everything that you're doing, like the direct recipient of this health care movement that you've started?
Well, the direct recipients are the government workers, and then the government workers, and then also we trickle down to the communities.
Is it the community only around the state, the interstate only, or maybe you're stretching into other close ones?
Um, we have to start somewhere, so we started with the civil servants, and then we move it on. Like I told you, now we have also included pensioners and others, teachers into the scheme. So we also go to the vulnerable and all. So we try to reach as many people as possible.
Oh, I can hear that so far. There's a lot that you've done. And what is the plan for the future?
Okay, the plan for the future is to close the gaps that I said we have currently. And we have partners that we're working with to ensure that we are able to provide the necessary infrastructure for people to access care, and to also ensure that the enrollment pool is widened to accommodate as many people that need the healthcare as possible. Financing has been an issue, but we are working on that to ensure that when everyone keys into it, then we're able to get a larger pool of funds to take care for the people. So that has been the thing, to make sure that we enroll more people, increase the capacity of the hospitals, and also building capacity in terms of manpower. We are building colleges of nurses and technical school of technical technology, carrying out postgraduate programs, so that we are building future leaders who can take over from us and who will also be able to provide the needed manpower, human resource for health, the needed human resource for health.
Okay, and then what about volunteers? Do you perhaps need any volunteers to actually start and joining the movement, or maybe you have them already, or you still want more?
Yes, we welcome volunteers. Like I said, we have partners. Our volunteers are called partners because some of the volunteers, volunteers come in different forms. Some provide technical support. Some might provide. They say, "Oh, we can't be around, but we want to support you in this way." Some physically are present to provide other kind of support. We welcome volunteers from any time.
So you've had people hands-on so far. You've had people who are very much hands-on, and that you can say you are proud about that.
Yes, definitely, yes.
Oh wow! So far, so good. So far, so good, Commissioner. I'm sitting here as well, proud to listen to you in whatever that you've been doing so far in the 15 years. It's the time that actually now shaken me a bit to say you've really done well. You know that time it's a long period of time. So all I can say is that. I'm very honored, sir. I'm very honored, and I just wish you can do more. I know that you also wish more for yourself, but I'm also sitting here to say I wish you all the best, and I wish you can have more in what you're doing, and also even stretching and spreading to other nations, because this is a very great movement. And may God bless you, and may God bless your hands as well. Whatever that you do, may it grow, may it increase. From me, Bongi Gladness, I just want to say thank you. I was very honored to have you here, and thank you so much. May you have a great day, and may it be productive all the time for you when you are doing whatever you do. Thank you so much, sir. But then I don't know if maybe you have the last word to tell the people out there that will inspire them.
Okay, thank you for giving me this platform to tell you what we've been doing. And I'm happy all the way from Spain to have this conversation with you. So we are free at any point. You can contact us for more. And we are willing, if there are volunteers in different ways that want to join us, fine, you can contact us. Thank you so much.
Okay, thank you so much, sir. Okay, that was Commissioner Samuel Ali, and I was very honored to be having him here. But from me, Bongi Gladness, I just want to say we discuss Africa on behalf of Africans to raise awareness. My name is Bongi Gladness, and it's a goodbye from me. Thank you so much, sir. Bye.
Bye.